Well, hello everyone, and welcome to today's webinar on the Wellbeing Index and how to reveal burnout in 9 questions. We're so happy you could join us today and dig into the functionalities of the Wellbeing Index and discuss how institutions across the country are using it to assess the wellness of their organizations. My name is Patrick McNally, and I'm an account strategist at MedEd Solutions. I'll be moderating today's webinar and fielding any questions or comments you have about the Wellbeing Index. As we get into the presentation, we encourage questions, so please take a moment now to locate the Q&A feature at the bottom of your screen. A new window will open up where you can ask questions and see our answers. Just a few reminders, you will be receiving a recording of today's webinar via email following the presentation, and will receive contact information for any follow-up questions. We also encourage you to go to mededwebs.com/wellbeing-index and try the Wellbeing Index demo for yourself. Okay, I think it's time to get started. I'd like to introduce today's presenter, Sunny Prabhakar. Sunny is also an account strategist at MedEd Solutions and has been vital to helping organizations understand and use the Wellbeing Index to assess burnout at their institutions. Sunny, take it away.
Thank you, Patrick. I appreciate the wonderful introduction. As I've worked with numerous hospitals and universities across the country, the best part of my day is hearing the stories of organizations who have been able to tangibly move the needle on the well-being of their staff. Burnout is a real issue in the healthcare industry, and it's encouraging to see so many of you on this call today. I appreciate you taking some time out of your day today to learn more about the Wellbeing Index, and I welcome any questions that you may have. So today, we're going to go through, who is MedEd Solutions? What is the physician burnout problem? A demonstration of the Wellbeing Index and how you can get involved. Before we begin, I'd like to disclose that much of what I'll be sharing with you today is based on the research and findings of Dr. Tate Shanafelt and Dr. Lottie Derby from the Mayo Clinic. They're the inventors of the Wellbeing Index and have dedicated many years of their careers bringing the WBI to life. I'll share with you a story of how it came to fruition in a little bit, but in the meantime, just know that I may appear smarter than I actually am. So a common question I'm always asked is, who is actually behind the Wellbeing Index? As we talked about, the Mayo Clinic developed their tool for their own internal purposes, but a couple years later, they had so much interest in that the Mayo Clinic decided to license the index to MedEd Solutions. We were the web and application development company that worked with Dr. Derby and Dr. Shanafelt on the first version of the WBI way back in 2014. We're based in Rochester, Minnesota, right near the Mayo Clinic. And for the last 10 years, have worked out extensively with departments throughout Mayo Clinic on various web-based projects and initiatives. We also have an office in Phoenix, Arizona, and we continue to work with healthcare companies throughout the United States. So let's begin by talking a little bit about why we're here today. So there's some challenges of emotional health and burnout here. So the majority of physicians believe that their workload is too heavy. Over half believe family and personal lives suffer because they are a physician. And only about 1/3 believe work schedule leaves enough time for personal or family time. And that's how burnout is affecting many of our healthcare workers. The reality is that the majority of physicians feel their workload is too heavy, things are happening in their lives, and they don't have enough time to handle all the things that are going on. Part of this could be due to that nature of the physician work environment. It's often a hostile work environment with excessive demands on time, a chaotic pace, limited control over input variables, and a feeling of isolation. This and other factors, which I'll discuss shortly, have led us all to know the term burnout. But what does it really mean? Well, burnout's a symptom of depersonalization, emotional exhaustion, and low personal accomplishment that leads to decreased effectiveness at work. So if you look at that just a little bit closer, we can see that depersonalization is beginning to treat individuals like objects. Emotional exhaustion is losing that enthusiasm for the work that you do. And low personal accomplishment is essentially losing a sense that your work has meaning or feeling effective in your work. Now, we all know that burnout among physicians is much higher than other U.S. workers. So it's not just a problem in the United States across all industries. In a 2013 study of the general population versus physicians, it showed a 38% burnout rate for physicians compared to only 28% for US workers. We also learned that from 2011 to 2014, that number increased 10% for physicians and decreased for the overall US population. So we can see that the problem seems to be getting worse for physicians and just better for the general population. We also know that the burnout rate among physicians varies widely depending on their specialty. National studies suggest that 45% of US physicians are experiencing burnout. But as you can see from this chart, that the rate among emergency medicine physicians is well over 50%. And the burnout rate among dermatologists is closer to 30%. So it's going to vary greatly between specialty and oftentimes between departments and locations. In simple terms, Dr. Schoenfeld has categorized the drivers of burnout into 5 dimensions. Those include workload, efficiency of work, physician autonomy and flexibility, work-life integration, and their sense of meaning in work. To make matters worse, the 5 dimensions are compounded by other external factors such as personal factors with family and things at home, to work group factors, to hospital and institutional factors, and national factors like national healthcare policy. So we know that burnout has professional consequences for the physician and the institution, such as a reduction in patient satisfaction, a decrease in professionalism. They may reduce hours or seek alternative professional roles, and burnout is also associated with an increase in medical errors. In a study of US surgeons, 9% self-reported that they had a major medical error in the last 3 months. We also know that the medical errors lead to additional distress. And additional distress is going to lead to increase in medical errors. But along with professional consequences, we also have personal consequences of burnout, such as increased cynicism, a loss of commitment, a loss of meaning in work, and an increase in suicidal ideation. In a study of US surgeons, 6.4% had thought of suicide in the last 12 months. Now that might not seem like a big number, but that's 1 out of every 15 surgeons. To make matters worse, only 26% of physicians will actually seek help compared to the US population, which is much higher at 40%. This is probably due to the fear of losing their license and the feeling that they're not supposed to be the ones who are sick or feeling that way. This may not need to be mentioned, but depression is the strongest variable in correlation to suicidal thoughts. So as you can imagine, when Dr. Schoenfeld and Dr. Derby were studying this problem almost 8 years ago, they wanted to help Mayo Clinic reduce burnout and increase engagement. There were tools available such as the Mazak Burnout Inventory, surveys on suicide, depression, etc. But as you know, physicians are already oversurveyed. They figured if they could just take a qualifying question from each survey, they would have a relevant tool to predict overall distress. Essentially, they took the best questions from each survey. The one that the majority of people who answered this question this way were either depressed or suicidal, etc., and turned them into yes or no questions. So the Wellbeing Index was born as a simple 7 or 9 question survey in an effort to predict risk for distress, track physician well-being over time, and provide access to timely resources. Our goal is to hopefully move them from a pre-contemplation stage to contemplation about their current well-being. Comparing them to their peers is an excellent and effective way to do that. And the most important factor is that the WBI is 100% anonymous and administered by a third party. So the physician can answer truthfully and honestly and not fear any repercussions from how they're answering the questions. So like we mentioned, the first important pillar of the Wellbeing Index is the anonymous survey of 7 or 9 simple questions. This allows the physician to get immediate feedback on their well-being compared to their peers and the ability to track their well-being over time. Now, it's important to note that the well-being is not a diagnostic tool. It simply predicts risks towards several dimensions. These include fatigue, depression, burnout, anxiety and stress, mental, physical quality of life, and work-life balance. So while there are excellent tools for surveying and predicting burnout alone, such as the Mazak Burnout Inventory, we feel the Wellbeing Index does a better job at predicting overall well-being across several dimensions. But most importantly, It's not just a one-time survey. It's a lifelong tool to continue reassessing over time. A second important aspect of the Wellbeing Index is what we call the just-in-time resources. After we give the participant their well-being score and how they compare nationally and to their peers, then they can access the resources. We have 11 different categories with a video from Dr. Schanfeld or Dr. Derby on each topic and how it relates to that specific version in their job role. We also have other relevant links to various publications, websites, and related videos. It's important to know that those who chose to license the tool can also add in their own local resources, such as links to your intranet, PDFs, helpful resources, and in your EAP phone number. Finally, the third pillar to the Wellbeing Index is institutional reports. While the WBI is 100% anonymous, we do give those who license the tool access to de-identified aggregate reports as to how their physicians or residents or nurses or APPs are doing. By default, we provide reports on the percent of physicians with a high level of distress, mean score by gender, specialty, year since graduation, and the resources that have been accessed. We do this to provide feedback to the institution, hoping that they'll use this data to identify their most at-risk groups and implement wellness initiatives. Then, as those programs are implemented, leadership can continue to review mean scores, check outcomes of their efforts. So before I begin our live demo of the Wellbeing Index, I'd like to cover a few key aspects. Those being that first and foremost, the WBI is for the healthcare worker. It's the reason that it's 100% anonymous, because we want to remove the fear of self-assessing and the implications of not scoring well. And if they don't score well, we want to provide them with the just-in-time resources to hopefully begin their journey toward improved well-being. So often, healthcare workers are taking assessments or surveys, and they don't even get to see their own results. So we wanted to make sure that we're providing as much value to the participants as we are to the institution. So with that, I'm going to show you the Wellbeing Index in action. First, I'll show you the experience of the WBI from the vantage point of the physician. And then I'm going to show you what the back-end de-identified aggregate reports look like for an institution. We have the Q&A button in the bottom right. So please utilize that to ask any questions that you may have. And I'll rely on my expert here, Patrick, to field some of those questions as well. And as soon as I finish with the demo, I'll pause for 5 to 10 minutes and we'll go through those questions individually. But first, let's take a look at the demo. So here we go. We'll look at what a physician will go through. So prior to getting to the actual assessment or the actual survey, they're going to go through a sign-up process. So they have an invitation code. They'll sign up and they'll answer certain demographic questions. The 3 demographic questions that we will always ask for physicians will be gender, specialty, and year since medical school graduation. Those who license the tool will have the ability to ask 3 more custom demographic questions that could be location, or are you enrolled in a wellness program, yes or no, or describe your role versus if it goes further into like surgery versus clinical, those kind of items. Then they'll be presented with the index. We'll always show them this box here. So talking about the anonymity, how their privacy is protected. They can actually see what a sample admin report looks like, so they can see that it's de-identified and aggregate data, and that they can't be singled out because of how they answer here. Then they'll go through and answer these questions. So during the past month, have you felt burned out from your work? Have you worried that your work is hardening you emotionally? Have you often been bothered by feeling down, depressed, or hopeless? Have you fallen asleep while sitting inactive in a public place? Have you felt that all things you had to do were piling up so high that you cannot overcome them? Have you been bothered by emotional problems such as feeling anxious, depressed, or irritable? And has your physical health interfered with your ability to do your daily work at home and or away from home? For the physician, they'll have questions 8 and 9, which are on a sliding scale here. So they can say, is their work meaningful to them or not? And does their work schedule leave them enough time for family or personal life? And then they can submit the index. So right away, they'll be able to see their scores here. Now, this is a special call-out box that will only show when a person or participant has scored lower than 70% of the national average, so that we can provide them the NAMI Help in Crisis line, the National Suicide Hotline, as well as a fully customizable field here where the local person that they can chat with, they can give them a call here. When they look at their score, they'll be able to see what is their well-being in comparison to physicians nationally, but then also into physicians within the organization too, so they can see how they compare as well. Now, if we look at the series of scales that they're seeing, it would be medium work, likelihood of burnout, severe fatigue, work-life integration, risk for medical error, suicidal ideation. So they can kind of self-assess and say, okay, I need a little bit more help here when it comes to burnout in comparison to physicians nationally, and I'm doing all right when it comes to meaning in work. And then I can also see where I'm at in comparison to physicians nationally when it comes to risk for medical error, suicidal ideation, severe fatigue, and those certain scales. As soon as they've taken more than one assessment, this graph will populate so they can kind of see how is their well-being over time. And they can go back into previous assessment results to see what was their score then and how are things trending. Then we'll show them, based on their responses, we'll show them 4 tailored resource categories. We mentioned there was 11 in those earlier slides, but we'll show them 4 that we feel like they need the most help. They can click into the resource category. We mentioned there's a video here from Dr. Derby. This is a fully customizable field on our advocate and champion plans, which we'll go to in a little bit. So you can put in your own local resource from the assistance program to urgent care numbers to mental health resources. So they could be, did you know that we have a 50% off on our gym membership or spa, or to links out to other helpful resources that are specific to the organization. Following that, we'll have national resources, key publications, and we'll have all that populated automatically within all of our resource categories. As we mentioned, there's 11 resource categories, and no matter which category they go into, it's a similar format where they'll get a video. Here's Dr. Schanfeld speaking here, and then they'll go into the customizable local resources here, and then the national resources and key publications. Many of our institutions find it beneficial to incentivize the Wellbeing Index. So getting more people to take the index, and the way that they can verify that they've actually taken it is that we can generate a custom transcript. So I'll show you what that looks like. They can select the date that they took the assessment, hit generate custom transcript, and we'll create a PDF that they can download or print or send as an attachment. It'll have their name, it'll have the date that they took the Wellbeing Index, and it just doesn't show any data or anything like that, but at least gives proof that they've actually completed the index. On our champion plan, which is on our higher level plan, we have the ability to do process improvement survey questions as well. So what will happen with our recent update that we're launching this week is that as soon as if you're on the champion plan, as soon as you finish taking the assessment, you'll be shown these 2 customizable questions where the organization can get feedback. So if your leadership could do one thing to help improve your well-being in the next 6 months, what should it be? And they're able to give long-form feedback anonymously and hit submit feedback. So this is helpful when you're thinking about how to structure interventions, or if you want to get a pulse on how is the efforts working, do it that way. It's a great option to get feedback straight from the tool. So I'll move on to what it looks like from the administration side so you can see these reports. The reporting populates live. We give you full access to everything that's happening. As we mentioned, these are de-identified aggregate reports. So what that means is that you need at least 5 assessments within a demographic field for us to show you the data. So as part of the advocate plan or on the base plan, you have access to the data broken out by single demographics. So you can see it broken out by gender, specialty, year since graduation. You'll get the overall organization, how it's performing. So if we dive into these reports a little bit, When it's broken out by specialty, it'll give you the mean distress score here. It'll tell you how many people have assessed within each specialty. And as I mentioned, if there haven't been 5 assessments in a specific specialty or a specific demographic, we won't show you the data. We'll just say, hey, sample size is too small. Only 1 person took it. As soon as 4 more people take it, we'll show you that data. You have the full ability to configure the report in here. So if you wanted to see well-being index score by specialty for the last 6 months and compared to the 6 months prior, you can do that. You can say, I only want to look at first-time assessments versus recent assessments. You can, a lot of customization here. And then if you update report, boom, it gives you side-by-side comparison of the last 6 months versus the 6 months prior to that. And shows you percent change and all of that. And you do have the ability to download, whoops, I just downloaded it. The ability to download this as a PDF, a JPEG, if you want to include it in a report or presentation. And we do give you the ability to download it as a CSV file. So if you wanted to export the data into Excel or into Google Sheets to do your own reporting, you have that ability to do that. It won't be the raw data. It will be this aggregate de-identified data. On the champion plan, when we get into reporting, you have the ability to combine demographics. So instead of it being broken out by a single demographic of just looking at men versus women or just looking at different specialties, now you have to say, I want to look at male physicians who are practicing family medicine and pediatrics. What does their distress score look like? Or what does their well-being index score look like? And so then you can see males practicing family medicine. We had 26 people take the assessment. Here's their distress score. Here's the comparison to how the organization is performing. Here's that comparison to the physicians nationally. Again, you can configure this report to do some comparison. You can configure it, you can download the report as a CSV, PDF, or JPEG. The other helpful reports that we'll build in that are included in both of our plans is going to be the engagement reports. So we can see how many people have signed up, how many people have assessed here in blue versus reassessed. We can also see what resources the physicians are actually accessing. So if we can see that more people are looking at money, for example, versus stress and resiliency, then maybe we should build up some programs or interventions surrounded around financial wellness to help move the needle on our well-being. So those are really insightful to see what the physicians are actually paying attention to or looking at. We also have survey reminder emails that automatically are sent from the tool. We'll show you what the performance looks like. Are they being delivered? The open rates? Are they clicking on the assessment? All of that information there. So going into the reminders, notifications on our champion plan, you have the ability to change and adjust how often people get reminded to take the assessment. Now they have the ability to take the assessment every 30 days if they so choose. We've seen in most cases that they need a prompting to go back into the well-being index. And so that's where these reminders can be really helpful. So you can even remove it to make it that, only every 3 months they'll get a reminder email that'll come straight from the tool. And so that can be done all within the settings here. We'll provide a full starter kit that includes email templates that have like all of our information, and we'll include the rollout plan, which includes an email cadence of what we've seen to get the best participation rates. You have a dedicated project manager, project specialist that will work with you in customizing the resources and the custom demographic questions, and as well as getting these rollouts and re-engagement campaigns. And you'll have them throughout the life of your license. So it's not just we roll it out and good luck. We'll be there with you throughout the entire process. From here, you can also customize the questions yourselves. You're able to update resources yourselves. You can customize the process improvement survey questions, invite participants straight from the tool. You can add as many admins as you like. There's no limit. So whoever you want to have access to the data, you can add them here. We really give you the full tool suite here to really run with it, but we'll go through full training as well as part of the kickoff process. Did I miss anything, Patrick, on the? Tell me what you think.
No, you got it.
Okay, great.
We do have some questions though.
We got some questions. Perfect. Let's go through it.
So first question is going to be, we have multiple locations. How are we able to separate the data by location?
Yeah, great question. So that goes into our custom demographic questions here. So you would say, please select the location that you spend the most time at if your physicians move around, for instance, or you could say, select the location that you are at. And what will happen is that we will build out custom reports based on those custom demographic questions following these reports here. So you'll see well-being index score by location. And then if you wanted to say, okay, I want to look at X location and I want to see family medicine and women that are in family medicine, you can do that on our champion plan and filter based on that question as well.
Great, thanks, Sonny. Is there a minimum number of participants that we need to have taken an assessment before we're able to see the reports?
No, you need, well, I guess with a caveat, you need at least 5 in a certain demographic area for us to show you the data. And then if we saw on the participant side, when we're able to see in comparison to the organization how they're performing, we need 100 assessments within the organization to show that data point. If we don't, until we get to 100, that data point won't show up. And then once we get to 100, we'll show that data point of what the organizational average is.
Great, thank you. Sonny, I know you said that we have the ability to put in custom local resources. What if we don't have a resource for one particular category?
Yeah, great question. So the only thing that we require is going to be a phone number for them to contact on the local side. The key publications and the national resources are great, and honestly, the videos help a lot of people. So if you don't have a resource for a certain category like financial wellness, no problem. But we do require a phone number in case someone wants to talk to someone within the organization because they're really struggling with that. That's the only requirement.
Great, thank you. And then last question, so how many institutions are currently using the Wellbeing Index?
Yes, we have close to 600 institutions that are using some version of the Wellbeing Index.
Great, thanks for sharing that. And we are getting some questions on what other versions we have available besides just the physician version, and some questions on pricing, and I know you're going to get to that. So
yep,
I'll turn it back over to you.
That's a good segue, because that's exactly what we're going to go into. As you might be wondering, I'm sure there's a lot of questions on the pricing and the plans and what that looks like. So we have 3 different plans. The first being the promoter plan. So the promoter plan is a good way if the organization would like to just provide a way for physicians, resident fellows, medical students, employees, APPs to assess their well-being. It's a completely free plan. You basically fill out a short form on our website. We give you access. The participants are able to take the assessment, track the well-being over time. There's no customization involved in the promoter plan. So there's no custom demographic questions if you have multiple locations. There's no ability to put in custom local resources. And then on the admin side, the only thing that you'll be able to see is how many people have actually signed up to take the assessment, but you won't be able to see any of the aggregate or de-identified reports. But at least it provides help for the people within the organization immediately to assess and get their well-being. The nice thing about the promoter plan, though, too, is if you do move up to our higher plans, all of the data that is in there will just become unlocked basically when you go to the advocate or the champion plan. So the advocate plan, is going to give you access to those 3 custom demographic questions to slice and dice the data. It'll give you access to doing customized local resources. You'll get the dedicated project specialist to help roll out the Wellbeing Index and be with you for the life of the license. We get the Wellbeing Index participation plan. And then this is where the first step to getting the anonymous aggregated wellbeing reports. So these reports are going to be based on the single demographic like we saw on the dashboard. So you'll see wellbeing the wellbeing score is broken out by specialty, or by gender, or by years of medical school graduation, or by location, if that's a custom demographic question. On both of our plans too, you do have the ability to use our mobile app. So the Advocate plan, there is a mobile app available. It's a generic Wellbeing Index mobile app. And so how our pricing works is we have two fees. One is a setup cost, which goes into customizing the tool for the institution. And the next is an annual license cost, which is going to be for the amount of invitations that are being sent out to the institution. So for the Advocate plan, the setup cost is $10,000 and it covers one version. We have 6 versions total. And then the annual license is going to be $5,000 to cover up to 5,000 invitations. Now, some might be asking, well, what if we have more than 5,000 in an institution? Absolutely, we can go up. It goes in 5,000 invitation blocks. So the next tier would be up to 10,000 invitations, would cost $10,000 annually on the Advocate plan. And if we wanted to add any additional versions, so if you wanted to start with physicians and we wanted to add nurses, let's say the cost for the setup fee is going to be $5,000 for additional versions, in addition to that first initial setup fee. The Champion plan, that's where we're going to get more granular with the data, more access in the tool, more helpful information to structure interventions. So you get everything in the Advocate plan, but now we're going to get advanced reports. So we're combining demographics. So if you want to see men in the podiatry department who are in location X, you can see that specific distress score and tailor your interventions to the people who have the most need. You then will also have access to process improvement survey questions. Those are 2 fully customizable questions that will appear after they have completed the survey. Those questions could be anything from, like, if leadership could do one thing in the next 6 months to improve your well-being, what should it be, to how would you rate our well-being initiatives or programs. This is a chance to give anonymous feedback straight to the institution to help improve things organizationally, but then also how to structure interventions. So the setup costs are going to be the same for both the Advocate and the Champion plan. It's a $10,000 one-time setup cost for the tool, and that includes one version. Any additional versions are going to be $5,000. And then the annual license fee for the Champion plan for up to 5,000 invitations is $10,000, or essentially $2 per person if you have 5,000 people. And then if you wanted to go up to 10,000 invitations, it will be $20,000 per year on the Champion plan. Like I mentioned, we have 6 versions. So there's the physician version, the medical student version, the resident fellow version, employee version, nurse, and APP, which is our NP and PA dedicated version. You had the question of who's using the Wellbeing Index. So here's just a few of the notable institutions that are currently using the Wellbeing Index in some version. So Levi Health Network, Innova, Indiana University, Dignity Health. So it ranges from academic hospitals to actual hospitals to schools and universities as well. So this list is, obviously not complete. Like I said, we have close to 600 institutions that are using the Wellbeing Index. And in fact, in the last 90 days, we have licensed and implemented the tool to over 15 new organizations as well. Many more are signing up every day on that free promoter plan too. So with that, I'd just like to make sure that we leave some time to answer questions that you may have about the tool. So Patty, did we get some more questions here?
Yes, we do. One, if you could clarify one thing for us. So on the participant side, it's required that 100 submissions for them to compare their score to their organization. Now, that is 100 assessments total, not unique participation.
Yeah, good question. So yeah, 100. We need 100 assessments total. Correct.
Yes. Okay. Another question is, how does the system know that someone is logging in from a particular institution? and how do organizations send emails so that they can invite people?
Yeah, great question. So what will happen in kind of the process is that we'll fully customize the tool. We'll work with you on the resources and those kind of things, and then we'll provide a unique invitation code that will get sent out to the nurses if it was the nurse version, and then the physicians would have their own unique institution code that would be for the physician version. So we work with you on helping compile that email list that you can either send through the tool, or what we've seen work actually better is when the organization sends it from a .edu or .org their email, so that we ensure delivery rates are high. But the way that we make sure they get into the right version is through that special invitation code, and they'll have to use that when they start the sign-up process.
Great, thank you for answering that. I think that covers all the questions. Unless anyone has any last-minute questions, feel free to use the Q&A button if you have anything.
Yeah, please, ask the questions. Definitely. I mean, the same questions that you guys you're thinking about or asking, I'm sure everyone else has as well. I will say that, myself, Sonny, and Patrick here as well, I think we'll be sending out a meeting link afterwards. If you prefer, if you feel more comfortable in a one-to-one setting, I'm happy to walk through the demo, or happy to answer more questions specifically for institution, like more specific to your institution, if you feel it would be helpful. We're here to be the resource for the Wellbeing Index as you kind of explore your different options.
Sonny, we do have another question. In the promoter plan, do you supply any reports to indicate how often the system was used? Yeah,
so we'll tell you how many people have signed up. What we can also provide on the promoter plan is a one-time snapshot of the data, which would kind of give you that information. I think that what you're referring to as far as number of assessments, number of reassessments, the kind of activity that's happening within the tool. The cost for that one-time snapshot is $1,000, but it could be a helpful way to prove the value of what's happening on the promoter plan to upper leadership or others.
Great, thank you, Sonny, for answering that. And we will stick around here for a few minutes as well if you have any follow-up questions.
Yeah, and I just want to say thank you again so much for attending and for your attention here. Like I mentioned, you're going to receive an email with a link to the recorded version of this session. It's also going to include some information on how you can learn more about the WBI, sign up for the promoter plan, advocate, or champion plan, and how you can book a meeting too. We'll include all of that in the email follow-up. And once again, thank you so much for your time today. I know you all have busy lives and other things to do, and so really appreciate you taking the time to think about well-being for your institution. And with that, like Patrick said, we'll hang out for a little bit, and if more questions pop up or other things you want to know more about, we'll be here for that.